Hello and welcome to Onlife Health's educational webinar series. I'm your host, Michael Detner. Today's topic is preventing low back pain, presented by health coaches Robin Pounds and Rachael Brooker. Robin has been with Onlife since November of 2011. She has a bachelor's degree in dietetics from Western Kentucky University and a master's degree in nutrition and exercise science from Lipscomb University. Additionally, Robin is a certified health fitness specialist through the American College of Sports Medicine. Rachael has been with Onlife for 8 months. She holds 2 degrees from Middle Tennessee State University, the first being a bachelor's degree in community and public health, and also a master's degree in health education. Rachael is a certified health education specialist, as well as an ACSM certified personal trainer. She will be returning to school in the fall of 2014 to become a registered dietitian, and also to earn her certificate in dietetics. And now, without further delay, please welcome Robin and Rachael.
Just to get started today, we're going to give you a brief introduction into back pain, anatomy of the spine, go over main causes of back pain, as well as preventing back pain, where most of our focus will be. We're going to go over several different areas: posture, exercise, lifting techniques, and we're also going to go over non-surgical treatments and when you should go see your doctor. Let's get started with just some facts about back pain. 75 to 85% of people experience some type of back pain at some point in their lives. The back pain can range from a dull, constant ache to sudden, sharp, acute pain that can suddenly make movement impossible or difficult. And then also, back pain is the leading common cause of job-related disability currently, and still a leading contributor into missed work. And also, the United States spends $50 billion a year on back pain and treating it currently. Let's talk about the differences between acute and chronic back pain. Acute back pain can last several days to several weeks, often stemming from disorders. The pain can often radiate as well, so you can have back pain or a back issue, but it would be radiating to your shoulder or a similar area. Acute pain is also often from trauma or stress on the spine. Chronic back pain is often less common. It usually lasts greater than 3 months, often very progressive, continually getting worse, and then it's also difficult to determine the cause.
Okay, this is just a good picture here of the anatomy of the spine. This covers the main 5 areas of your spine. It starts with the cervical, which is mainly around your neck area, the thoracic, which is the upper part of your back, the lumbar, this is the most common where lower back pain is, the sacrum and coccyx, this is more in the hip and then the tailbone. So it is really important to be familiar with these main areas of the back, so when you are talking with a doctor, you are pretty clear about what area of your spine is in pain. I'm going to also go over some of the causes of back pain. The first one here being age. Typically around your 30s and 40s is when most back pain begins. However, it can start as early in your 20s. Usually after your 40s is when it becomes more frequent. Then fitness level is also a main cause of back pain. Back pain is more common among people who are not physically fit. Weak back and abdominal muscles may not properly support the spine. Being overweight or obese, inactivity and poor eating habits can lead to obesity, which can put unnecessary stress and strain on your back. Injuries as well, spine injuries such as sprains, fractures, can cause either short-lived or chronic back pain. Sprains and tears can occur from twisting or lifting improperly. Can also be caused by accidents or falls. Smoking. Surprisingly, smoking does play a role in back pain. Studies show that cigarettes affect the way the brain sends its pain signals. Smoking may also damage tissue in the lower back and elsewhere in the body, slowing down circulation. Inherited disease. Some causes of back pain, like forms of arthritis, affect the spine and have a genetic component. Stress. Unmanaged stress can lead to a number of physical and emotional health issues, and one of the main ones is lower back pain. Improper shoes as well. You know, if you have flats or heels, sandals, and you have to stand for a long period of the day, this can cause back pain. Your feet are your foundation of your body, so wearing improper shoes can throw off your body's alignment. So it is important to wear proper shoes that do have a good fit if you do stand on your feet for long periods of time.
Now we're going to talk about preventing back pain. We've split it up into two areas, lifestyle habits, which are, we're going to talk about several lifestyle modifications you can work on, and then just having healthy back habits. We're going to get started with those lifestyle habits. Regular exercise is one of the main ways to prevent and recover from minor aches and pains. Cardiovascular, the recommendation is to get 150 minutes at minimum a week of moderate activity. So working on weight loss through that cardiovascular exercise can help you prevent back pain. Also strength training, focusing on your core muscles and your lower back muscles as well. Having those strong muscles can help take some of the stress off the spine and really just help support your body and handle all the strain you put on a regular basis. Flexibility, stretching. We want you to become more efficient at stretching before and after repetitive actions, before and after exercise, and just throughout your daily life. And then working on your balance as always, those really small muscles in your ankles and all your stabilizing muscles to help prevent falls will also help prevent back pain. Avoiding tobacco. As Robin said, that surprisingly tobacco and smoking do affect back pain. So avoiding tobacco if you're not currently a tobacco user. And if you are a tobacco user, going ahead and working on quitting. Also, if you already have back pain, quitting smoking as quickly as you can is very beneficial. Smoking does slow down recovery time for injuries, including back pain. It also slows and reduces circulation throughout your body and can cause degenerative spine issues. Also, managing stress. This is a huge one for back pain. If you have chronic stress, it can really affect your back. It shows up in a lot of tension throughout your neck and shoulders, lower back, as well as your jaw and areas like that as well. Two ways to really prevent your back pain by managing your stress is trying to reduce your stressors, working on better time management, better financial management, things of that nature, as well as working on your coping skills, learning how to handle situations when you get stressed, handle things in the heat of the moment, as well as working on relaxation techniques, things like progressive muscle relaxation and deep breathing as well can help. And touching again, decreasing your weight for preventing back pain. If you're overweight or obese, definitely working on decreasing weight. If you have excessive abdominal weight, it's going to pull your spine forward, so we do want to encourage you to lose weight to prevent that back pain and recover from back pain as well.
Okay, I'm also going to talk about healthy back habits, and then the first one here would be to improve your posture. I know a lot of people who do work long hours and stand a lot during the day or even sitting. Getting used to focusing on your posture and making it a habit to have good posture and sitting straight. I'm going to kind of go into some examples here. Here's a first example of incorrect versus correct posture. As you can see in the first picture here, I'm kind of slouched over. It's a little exaggerated, but that's kind of how we all feel at the end of the day. So it is really important to focus on your posture and make sure you have that vertical, line. You have your shoulders back. If you're balancing your weight on each foot here, and then just kind of, you can always tell by acting like there's an imaginary string and it's pulling you up vertical. You really want to keep a straight line body and have your weight evenly distributed. Here's a side view of my posture. As you can tell in the first one, correct versus incorrect, you can tell I'm still slouching over. And then the second one, the correct example, you see that natural curve of my back. My shoulders are slightly back. My weight is again evenly distributed. And then my chin is also up. Here's an example of a sitting position of incorrect versus correct posture. And this is really common for people who have to sit in a chair for long hours in the day. You can kind of notice if you start to pay attention to your posture beginning to slouch throughout the day. So really focusing on having good posture. In the second picture, you see that my chin is up and I'm looking straight. You really want to have, if you're at a desk looking at a computer screen, have your computer screen eye level. And then also having that upper portion of your body still pretty vertical, straight back, and then shoulders back as well. This is kind of a new one here. There's a block. Try to find, if you do have to stand for long hours in the day, finding a footstool or a prop where you can put one foot up at a time and then transferring your weight back and forth. This is really good if you have to stand at like a cash register for long periods of the day. Or even at home, it is a really good idea, like if you're brushing your teeth, opening up that drawer underneath the sink before you lean over and brush your teeth. This is another good one to help with posture. And then I also want to talk about proper lifting techniques. These are some examples here of how to lift properly if you do have to lift on a regular basis at work. It is really important to follow the proper steps. The first one here would be to bend at your knees instead of your back. And I know it is really easy to lean over with your back, but you really want to focus on bending at your knees instead of your back and when you bend down to grab that object. The second one here would be keep your chest forward and lift with your legs. This is another example. You see that my legs are the ones lifting here, not my back. And then the last one is just keep your shoulders in line with your hips when you bring that object up. So following proper lifting techniques can also help you avoid back pain.
All right. Another area of healthy back habits, we're going to talk about back exercises, way to strengthen your core as well as your lower back. Again, strengthening those muscles can help alleviate some of the daily stress and the way that the weight is distributed on your spine, relieving some of that lower back pain. These exercises are to prevent, but also to recover from minor aches and pains, just from weakened muscles and poor posture. So we're going to start with these two exercises. I have several standing exercises, and then we'll move on to some floor exercises as well. We're going to start with the wall plank. You want your shoulders to be down. You want your feet, they can be close or spread apart. The width of the base of your feet can increase or decrease the intensity of the exercise for you. Stand far enough away from the wall. Put your forearms on the wall. Really engage your core. Keep breathing slowly in through the nose, out through the mouth, exhaling. And then you can do this hold this for something like 30 seconds. Try this for 3 sets. Do this 3 times. And then as well, wall sits are a great exercise. This is a bit of a leg workout as well as it's going to be for your core. You want to sit in the wall like you're sitting in a chair with proper posture and slide down the wall. Keep your shoulders back and your shoulders down again away from your ears. Again, engaging your core. And you will see with me doing the wall sit, there is a natural curve of my back still. You don't want to flatten your back against the wall. Here's a one-legged deadlift. This is a great exercise for your lower back and for balance. So what you see me doing here is I'm standing tall, good posture, and then I'm leaning forward, lifting one leg and going down with both hands. You can do this weighted or as I'm doing it without weights, but also if you feel uncomfortable, you could do it with a chair possibly in front of you as well. I do encourage you to find a spot on the wall or the floor, and as you're bending down, staring at that one spot, that will help you balance. If you're doing this weighted, you can just go down, hold it for 1 to 2 seconds, come back up. Try doing that anywhere from 10 to 12 times and doing that for 3 sets. Here we have standing high knee crunches. This is a great option if you can't get on the floor and do crunches and sit-ups, things like that. Standing tall like I am in the first picture, you want your elbows squared out, your feet about shoulder width apart, and you're going to bring your right elbow in to meet your left knee. You want those to meet. You want to stand tall, keep your shoulders back. You don't want to bend over, engaging that core. Breathing out when you're pulling those, your elbow and your knee together. And then you can just do that movement quickly. You can do one side repetitively and then switch to the other, or alternate each time. Now we're going to move to the floor exercises. These can be a little bit more advanced, so if you feel comfortable getting on the floor, if you don't already have any back injuries or back pain, these would be really great to do. We want you to lay on the floor, get your heels as close as you can to your bottom, put your hands out flat by your side, and then we want you to lift your hips up off the ground. Look at this straight line that I have. I'm not overarched or slouching. And then if that position is challenging enough and you want to move forward, you can add a small pelvic tilt as well. Here's the bird dog. This is an excellent balance exercise as well as your core again, because you will keep your core engaged. You're going to stretch out. You're going to be on all fours. Get your joints lined up. You want your hands and your elbows to be right under your shoulders and knees right under your hips. And then you're going to lift your left arm and reach out with your right arm. You can work on holding that or just holding it for 1 to 2 seconds and then alternating sides. Again, stare at the floor for help with your balance as well. And then here's your standard plank. You can see trying to get a level back on your toes. You can do a form of this on your knees as well if it's new to you. A couple tips: you want your elbows right under your shoulders, and you do want your shoulders away from your ears. Try to stay relaxed, breathing in deeply and trying to hold this for as long as possible, trying it anywhere from 3 to 5 times. And then here's the last exercise. It's a great exercise for your lower back. You just lay out on the floor. Your feet and your ankles can be together or apart. You want your hands above your head, just relaxing, and then bringing your feet and your hands up simultaneously. Breathing in, holding that. If you're holding it, and that is, if you want to move forward with more challenging, you can do small flutters as well. Doing this like your planks and holding it for several seconds and letting go, doing that several times, anywhere from 3 to 5. Really will help that lower back without any weight or machines.
Okay, stretching is also very important when preventing back pain. Stretching can help reduce muscle stiffness, help relieve aches and pains, and also decrease muscular tension. It is recommended by the American College of Sports Medicine to stretch 2 to 3 times a week or as needed. You can stretch daily if that helps with your back pain. Each stretch should be held from 10 to 30 seconds and then repeat 2 to 4 times. I'm going to go into some examples here. The first one is the side stretch. This is a very easy stretch that you can do almost any time during the day. What it is you just stand using good posture, grabbing one of your elbows after you put your hands over your head, grab one elbow and then lean to the opposite side. And then you can just hold this for 10 to 30 seconds on each side. This is called the upper back chest opener. What you're going to do is also just stand there using good posture, feet shoulder length apart. Grab the lower part of your back, and then you're just going to look up towards the sky and really open up that chest. And you will feel this stretch. And again, you can just hold this for 10 to 30 seconds and repeat 2 to 4 times. This is called a standing spinal twist. In this exercise, you're just going to grab your sides of your hips, and then you're just going to do a spinal twist and just twist looking back. You can do each side and also just hold this stretch for 10 to 30 seconds and repeat 2 to 4 times. This last one here is called a shoulder opener with the wall. This one's a little bit more advanced. If you are able to, go find a sturdy wall and put your hands down on the wall straight in front of you and then do a flat back. You're really going to feel this in the back of your upper legs as well as in your lower back. You're just going to hold this again for about 10 to 30 seconds if you're able to, and you can do it 2 to 4 times or as needed.
And the last area of healthy back habits, let's talk about your work environment. So with your work environment, whether you're sitting at a desk or standing all day, there's some things we can talk about. Robin did touch on having correct posture when sitting at your desk, sitting with your feet on the floor, shoulders back, as well as having your computer screen at eye level. If you're standing all day, possibly looking at some kind of mat or padding if you're standing on a concrete floor or a floor with poor foundation. If you're standing as well, propping your feet, alternating those, as Robin showed in the posture section. And then also, whether you're sitting or standing all day, making sure you're moving around every 30 minutes, taking a break if you're doing repetitive actions, stretching before and after your day as well. And the main area, proper shoes. There are 3 areas we want to focus on with how your shoes fit and how that affects preventing back pain. One of the main areas that affects how you distribute weight in your feet and across your spine are your arches. There are 3 kinds. You can have a high arch, a normal arch, or a low arch. There are shoes and inserts for all 3 of these areas. Most shoes fit an average arch. Just a slight curvature in the foot. If your arch is too high, that affects how you distribute the weight, and you would like to work on possibly, getting proper exercise shoes for that, or proper inserts for shoes that you wear on a daily basis. And there are also inserts and shoes for low arches as well. Toes. Make sure you have enough room for your toes, that they're not squished in there, but we also don't want your shoes to be too big. Ensure that there's a proper fit. Don't be afraid to ask someone to size you properly for your shoes. And then also your heel. We want to make sure that your heel is supported and that it's secure in your shoes. If you don't feel sturdy or secure in your shoes, it's probably not safe to wear them. The heel is the baseline for that proper line of posture, so we definitely want to make sure that is secure.
Okay, now I'm going to go over some non-surgical treatments. Typically, when you first tell your doctor that you know you are experiencing some back pain, he or she is going to recommend icing your back and then as well heating your back and kind of going back and forth through those every 20 minutes. You should begin icing your back within the first 48 to 72 hours. You can use an ice pack if you have one. If not, just grabbing a bag of frozen vegetables or a bag of ice, that can help. And then after 20 minutes, switching over to heat. And you can use a heating pad for this. If you do not have a heating pad or a heat wrap, you can just take a hot bath. And then after 20 minutes, going back to ice and then repeating. You can also consider consulting a specialist or chiropractor. You can do behavioral modifications, and this goes back to stress management, quitting smoking, beginning a regular workout routine, losing weight. And then the last one here is ask your doctor about medications. And then one last thing here I wanted to point out is inactivity may delay healing. And this is really common. A lot of people think that taking a day off of work and going and laying in bed is the best thing for back pain, but it's actually the opposite. You should continue to stay active and go take a walk and try to stay on your feet, and this will help with back pain. I'm going to now cover some reasons when you should actually go see the doctor. This is when back pain lasts more than 6 weeks. You have sudden immobility. This could be from an injury or a fall. You develop a fever. You definitely want to go check out and see why you have a fever because it could have an underlying issue. You have trouble urinating. This could have something wrong with your kidneys, so you want to go get that checked out. You develop weakness or numbness in your legs. And then if you have unintentional weight loss. So if you have any of these symptoms, it's definitely a good idea to go check out your back pain with your doctor.
Well, we have some references here that you may want to check out some of these places, and they're pretty reputable as well. For instance, from the National Institutes of Health and various places like that. I did have just 1 or 2 questions just to follow up here with the 2 of you. Let's say that I am someone who I might have some back pain now and again, and I don't want it to get any worse because none of us are getting any younger, right? there's probably, what, maybe 8 or 10 different exercises that we talked about here. What would be a good back care exercise for a beginner who doesn't normally do that sort of thing?
I think starting out with those first two, maybe starting with your wall planks and your wall sits. That way you have some support with you, and those can be pretty brief exercises just to get you started, and then maybe working your way into the floor exercises.
So starting with standing rather than being on the floor.
Yes.
For a beginner, right? And how often is this something I should just do once a week? How often and for how long should I do these exercises?
I think that's definitely up to you. We would definitely want to see it at least once a week. The rule of thumb is about 48 hours to recover between your muscle groups. So if you get a pretty good back workout in, you want to wait about 48 hours before you do it again. But like Robin was saying, stretching is something that you can do every day that can help your back pain.
Thank you. Well, one other thing, and this isn't really a question, it's more of just sort of a takeaway. It always amazes me how much we're learning even today about what tobacco smoke can do, not just to your lungs and not just to the people around you, but literally it can slow down healing and cause a bad back to be a worse back. And I'm really grateful that you brought that up, because it's yet another reason that if you do use tobacco, you just really, stopping is a very, very good thing to do. I noticed that we're really low on time now, and I want to, on behalf of Onlife Health, I want to thank both of you for your expertise and for working so hard on this presentation. And please tune in again as soon as you can. We hope to have more of these webinars on YouTube as soon as we possibly can. This is Michael Detner from Onlife Health. Thank you very much and have a great day.